Hi, my name is Isabella Hernandez. I am the social media and content development specialist here at JMIR. Today, I am joined by Evelyne. She will be speaking about her recently published paper in JMIR Medical Education. The paper is titled Education to Practice, Upskilling in Healthy Longevity Medicine, Results in Physicians' Implementation Intent, and self-reported clinical confidence. And this is a cross-sectional observational study. So I'll briefly pass it on over to Evelyne, where she can do an introduction and just give a bit of an overview of the study and as well as your role in this study.
So first of all, thank you so much for this opportunity, and we are extremely honored and very, very happy that we were accepted to publish in JMIR Education. We value the journal very much, and our group of authors, and in general our group, is a very special and unique group of people who are all volunteering their time and effort as medical doctors, as healthcare professionals, as medical students, as associates in different branches of medicine, in order to bring education of healthy longevity medicine to physicians, healthcare professionals, and investors and other people. So we really just want to bring the fundamental knowledge on aging mechanisms, biomarkers of aging, the skills and equipment of knowledge that a physician needs to have in order to further learn the clinical skills of longevity medicine and to apply the tools to the patients in a safe and evidence-based manner. And those people who are the authors are really representing more than 12 countries and more than 4 continents. And we have conducted a survey among our learners of the so-called Longevity Education Hub. So the group that I was mentioning is all around the Longevity Education Hub, which was created in 2019. It's our COVID baby, initiated by Professor Alex Jaworonko from Buck Institute and in Silico Medicine, myself and several other core authors who have established the courses. And then over the years, people were joining. This course, the curriculum, has been translated into more than 11 languages all around the world. We cover 90% of global language population, from Chinese to Japanese to Portuguese to Spanish, English, of course, and many more. And we thought, since we have this community that we built on learners, we have a database of everybody, we exchange newsletters, we organize webinars, we encourage everybody to be active and to discuss and to participate. We offer free participation online at the ARDD conference. It is one of the main conferences in the field. And we thought it would be really great to have an evidence-based approach on assessing how this education is actually influencing the way doctors practice, the way doctors see the field, the way doctors feel that there are barriers and what are the main barriers right now for them. And last but not least, also how patients respond to this development. And that was our study. That's exactly what we asked in a survey, a cross-sectional survey among all physicians, and demonstrated their responses.
Okay, awesome. Thank you so much. That was great. So basically for someone who's never heard of healthy longevity medicine, what is it really?
A great question, because there is so many misconceptions and obviously, sadly, also a lot of spam in our field. So healthy longevity medicine, per definition of the Healthy Longevity Medicine Society from year 2022 of expert consensus, is optimizing health span along the entire lifespan by targeting age-related mechanisms. And this definition is trying just to encompass that we are not here for life extension, but primarily for health span extension. We are here primarily to learn aging so that you will see Many people using now the word geromedicine, which is not geriatrics. It's very important not to be confused. We are looking at the gero process, aging, and we are optimizing it, meaning it is for people who are healthy and for people who are sick. It's for old and for young. Health span relates to everybody.
Okay, awesome. I know you mentioned geroscience there. For someone who's not exactly in that field, can you just quickly explain that? Is it a bit different there?
It's it's not different.
Mm.
It's almost like a synonym. Because some people wanted, in the scientific field, to have a stronger connection between the so-called basic research or basic science of longevity, which is called geroscience, and the clinical application, which so far we called longevity medicine or healthy longevity medicine, health span medicine. But then, there was the suggestion that maybe we can just call it geromedicine. Now, there is, of course, the backside that many people might confuse it with geriatrics. It's not the study of old people. Healthy longevity medicine is all about the entire lifespan. But it gives a little bit of a scientific touch to it because, unfortunately, also longevity per se as the word has been spammed by the misconception that it's about living forever, and it's not.
Right. Okay, perfect. Yeah, so I guess that just leads into my next question. What made you want to pursue this topic? Because healthy longevity medicine still very much feels like an emerging field. So when did you realize it was the right moment to start this type of curriculum?
Well, I for this I have to fully acknowledge and give credit to Dr. Javronkov because he was the initiator, the person who gave the idea, and the person who is so visionary that he always sees things on average 5 years in advance. And so he did. And so he did see it in the year 2019, where he said, there is a gap. We have to address a gap. So which gap? The gap between what we know in the basic research and the gap what you do as a doctor. And so let's do a course. Let's combine it in a way that clinicians can understand it. So it's not so easy to speak the language of AI algorithm, deep neuronal networks on biological aging clocks. Even some of the theories of aging are going so deep into biochemistry and cellular pathways, which we as clinicians not always deal with. And so we had to condense it really in a medical curriculum for doctors. And the main motivation was also to say, as the field evolves, more and more patients, people, they demand from their doctor of trust to give them the right advice, which supplement, what to do, what to measure, how to evaluate it. Doctors have to be equipped with skills. So that was our main motivation, and it still is.
Mhm.
And maybe I will have a chance to elaborate a little bit later what else we did with this curriculum further, because our main goal is really to educate not only physicians, but also medical students, the future doctors. And so we did that too, implementing this curriculum to medical schools.
Okay, awesome. Yeah, that's great. So why does it matter really that doctors feel confident in this area?
Great question. I mean, first of all, one of the main reasons is because there is demand
Mhm.
of individuals who read the news, who hear the news, who get tested more and more on various opportunities, right? The diagnostic part of healthy longevity medicine is relatively strong. It's more of the interventional and the analytical one that is less developed. Secondly, because we need to remember that safety comes first and do no harm. And unfortunately, in any new field, we have both the hype of innovation and also the danger of harm. And so we need to educate the doctors how to not harm. Third, this field is evolving, but it's evolving a little bit too slow in terms of clinical longevity. Basic research is booming and it's phenomena, but in terms of clinical, it's a bit too slow, and it's normal because we are limited by clinical trials, administration, and stuff. But the more doctors will be educated and apply whatever is there already evidence-based and bring evidence and do more trials and do more research and report it and talk to each other, the faster we advance.
Okay.
So yeah.
Okay, awesome. Yeah. So I know we briefly went over this in our first question, but can you explain a bit more the methods of this article? So who was included, what the curriculum contained, and the assessment tool?
Absolutely. So in our longevity education hub, in general, we have over 15,000 participants who took the course. However, in this survey, we specifically targeted a very small group. Well, it's still a big group. It's the biggest and it's the first publication ever on longevity education impact in the clinic. However, we really wanted to start with physicians who have completed their specialty training, meaning they are already practicing physicians with clinical experience, and those who have not only learned our curriculum, but also got certified, right? We have certification. So they took a test, a quiz, and they passed and they got the certificate. And those who actually then volunteered to participate. So we identified 590 physicians who would be eligible, and 113 of those have responded to our relatively extensive survey. They were representing 42 countries, so I think it's pretty representative. And by chance, they were actually pretty balanced in terms of gender. So we had males and females doctors. So that was really really great. And we asked several questions. First of all, we asked if after this education, the doctors actually initiated more frequently the discussion about health span to the patient, and they did. Like 80% did. Then we also asked if the tools that we are teaching about have been applied, and the tools in healthy longevity medicine for diagnostics means biomarkers of aging. So we specifically asked if biomarkers of aging have been implemented into the routine clinic, and more than 23% of doctors actually started to use it, and more than 50% those who used it already started to feel more comfortable and increased the use of it. And then also there was the question whether the patients actually had a positive reaction to the doctor explaining the paradigm shift about aging as a health span and function optimization and preservation. And over 73% of the patients responded that they are very positively sided to it. And then we ask also a question about how do the doctors think, would it be valuable and possible to implement such a medical program, medical protocol into the medical practice in general? And more than 73% of doctors answered yes. And it's interesting, those doctors were from different specialties: family physicians, internal medicine physicians, cardiologists, endocrinologists, so subspecialties of internal medicine. Those were the primary specialties where the doctors responded that yes, they want to implement it, patients want to have it, and they feel much more confident using all those tools after have been, through those courses and getting certified.
Okay, yes, great. So that sounds awesome. So I guess my next question was, can you explain the results? But I think you gave a pretty good overview there. If you wanted to add anything else on those results, or if you want to say what stood out to you the most out of all these results that you just mentioned.
I think the biggest part that I really liked from all of the answers is that the confidence of the physician to actually apply the knowledge of healthy longevity medicine in the practice, this was a staggering number. That was 96.5%. And that's massive. And why? Because if a doctor feels shaky about what they do, they just don't do it. And there would be no compliance, there would be no effect on patients. It's like a cascade of wrong things going on. So it's kind of clear that knowledge helps. I don't think that's a very new and shocking part. But to 96% of physicians across 42 continents, countries, and across different specialties, experienced doctors, not new fresh doctors, not our junior colleagues. That's quite impressive, because you hear so much about that physicians are resistant to healthy longevity medicine. They don't want to learn that, they want to apply, they are stuck in the sick care system. Well, no. Clearly, we had a population that was a little bit biased, so they chose to educate themselves. I'm fully for it. But I still feel that even among those, if they would feel it's like it's not good enough, this education, or it's not good enough for me even to feel confident to use it, we would not see 96.5% people answering. Yeah.
Yeah, 96.5 seems like an insane number, very huge, big number. Why do you think this shift was so big?
I think it's really because, against all odds, doctors really feel that they find a way now to apply not only prevention, right? Prevention is wonderful, and prevention is an important field, but something extremely anticipatory and something extremely novel, something extremely innovative. I think all doctors realize that it's important to have biomarkers that will give you more information, that will help you to make decisions, that will help you to optimize the patient rather than just managing the patient. Many of us are frustrated to work this way. And secondly, I think, we know now from many population health-based surveys that populations want it, need it. And I think, and the last point is, apart from personal opinion of a doctor, there is a very strong voice of several public health and governance institutions and departments of health and so on in many countries, that are leading the way, where physicians hear it and see it and understand that it's serious now. It's important to learn it. And that there is a competitive advantage for those doctors who actually learn it now.
Okay, yeah, no, for sure. And I noticed when reading your paper that over half of the respondents reported a shift in their perspective on aging specifically. What does this mean in clinical practice?
It's such a good question, because, as a doctor, the thing we learn about aging in our education mostly is, how do you deal with geriatric patients? And that's all that we hear about aging and old age. Some of us maybe learn regarding aging something about telomeres, which is only one of 12 hallmarks of aging, and something that is really, so I think there is a shift from not really even an opinion on aging, but rather the gap of what we learned and how we viewed aging, as in managing aging and handling a patient who is already suffering from pathological aging, towards aging starts at birth and actually preconceptional. And at every point of time, we have a specific pace of aging, and there are different mechanisms regarding aging. And it's an ongoing process that you can modify. So I want to learn about how to, right?
Right. Yeah, no, for sure. And I guess this just leads into the next one where what's one small change that a physician might make in the real world after completing this curriculum?
Oh, 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 so many good examples of an even small, inexpensive change. But one is just to add a different perspective. If I would be to choose one thing, it's like shift your perspective as a clinician from normal values. You are normal, you're within the norms, towards what's the optimal value for that patient. Anticipate, see the trajectories and trends rather than a punctual view, and either it's red or not red marked in the lab test. It doesn't cost much more time than evaluating a lab test, and it gives you already a big thing. Second is, another very good example is how do you communicate to the patient the point of aging? What are the fundamental, not only lifestyle interventions, but they are of course very important, but also what else can they do in addition, even without putting any money into it, in order to modify their aging. There's a big gap on what patients know and what they don't know. Yeah, and there's so many other things that can be done.
Okay, great. And I guess we can, lead into a more personal question. Did this personally change how you think about aging or longevity medicine?
I guess I'm biased because I co-created the course, and so I think my aging understanding shifted already way before that, and I was just very fortunate that I was working at the cross section of cancer and aging, which is the most related field, and I worked in the ICU. I saw death more than anything, and um, um, and yes, I did have a change. I did have a change. I wish I had this curriculum. I didn't have it. I had conversations with experts from geroscience. I had mentors who completely changed my view on aging, who opened the door of geroscience for me that I didn't know, and opened the doors of AI, which, as you might remember, 2019 was still at the black box, right? That we knew, and now we are very grateful that AI came up, generative AI came to everyday's use, so that people can understand what did we do with all those years with those algorithms and those clocks and everything. That was exactly it. Putting all the data, multimodal, huge chaos into an algorithm that can give us information.
Okay, great. So then my last question would just be looking ahead, how do you hope healthy longevity medicine will transform the way we think about aging over the next decade?
Wow, what a great question. So I really hope that we will start to think about aging as a modifiable, very, very complex algorithm. And we will be able to acknowledge the fact that AI can help us a great deal in order to really have a precision geromedicine, precision healthy longevity medicine. And I hope that it will also shift our thinking from, okay, it's not only how do we make the mouse younger, right? It will be really about how do we lead a human being from the moment of preconception through the entire lifespan, so that the aging process will not be associated with pathological loss of function, meaning really losing your function both cognitively and physically to the point that you cannot have not only quality of life, that's a little bit abused of a term, but really the now we have even the new term, the publication came up just this week, of peak span. How do you keep yourself at your peak performance level for the longest period of time?
Okay, awesome. Thank you, Evelyn, so much for meeting with me. And, your paper is really an incredible work, and we're so happy to have it in JMIR Medical Education.
Thank you so very much for having me, and thank you for publishing.
Thank you.